Um, so, dear students, would you like to talk first? Just unmute your mic and you can talk. You can ask anything else because we just want to make this entire session very interactive. We just want to know about you and we would like to get questions from you as well. So, please ask the questions or anything else you can ask from us.
Can you please introduce yourself?
Sure, sure. So, again, this is from Hriday, right? Okay.
Yes, sir.
Okay, let me
Uh,
introduce myself. So myself, Gaston Ravin Dias. At the moment, I am residing in Sri Lanka. So along with me, I would like to introduce my teammates, Sumi from India and Ashwini again from Sri
Hello.
Lanka. We
Hello.
have another team member who was unable to take part today. She is engaged with another work. So we three are the speakers. Again, we all three are biomedical engineers, having some certain years of work experience in different industries. So the concept of healthcare engineering was created because we are so much interested on biomedical engineering, and uh, it's too noisy from someone's background. Okay. At the moment, we haven't registered the healthcare engineering as a institute or office. So mainly we provide two kind of supports via our healthcare engineering platform. First one is for students. So for the students, mainly we give educative materials. We support the students in their academics. We help the students in their projects and different things we can do it for students. For the students, we have our own YouTube channel as well. So my team member, we can share the YouTube link here. So you can visit our YouTube link and you can get some ideas about modern medical devices. We talk about modern medical devices, how the advanced concepts are being used, and we have done some kind of interview with prominent professionals from the healthcare industry, and we have posted in the YouTube channel. You can get the valuable ideas from them. And we already done a certain number of webinars to several colleges, some Malaysian and some Indian colleges as well. So whatever the programs and whatever the educative materials we create, we post it on our YouTube platform. So those who are interested, please pay a visit to our YouTube channel and have a look at our videos. And if you really like and if you really enjoy, please subscribe and keep supporting us. So apart from the YouTube, we are very active in other social medias like WhatsApp, Facebook, LinkedIn, and every other social medias. So my team member can share the WhatsApp group particularly where you can join and keep in touch with us. Maybe because in future we have several other plans. For example, we are going to conduct some kind of a virtual training session, hopefully within this year, so students can get the trainings from us virtually, and other plans as well we have. So we would like to request the students to be part in our WhatsApp group. So my team member Sumi, please share all the links. Huh? And also, I would like to welcome you all to join in our Facebook group as well. So all the updates, whatever the educative materials or the new videos or the new projects we carry on, you can get all the updates and all the supports you can get from us. So that's for the student section. And for the healthcare businesses, we also support the healthcare professionals to promote their business, and we give some technical reviews for their medical devices, and we give some kind of consultations to improve their healthcare businesses. So these are the two main aims we provide through our healthcare engineering platform. Okay. So at the moment, we all three are working. So this is not our main job. This is our part-time job, and because of our interest and our because we are very enthusiastic on biomedical engineering and the healthcare, that's why we created this and providing these kind of webinars. So apart from these things, we are working in the hospitals and other companies as well. So any doubts you would like to know about us? So, madam, I'm waiting for your response to start the session. I can wait until you say we can start. Huh?
Yes, sir, we can start.
Okay, ma'am. So, shall we start now? Because we already have 63 participants.
Yes, yes, we can start.
Okay. So, luckily, I have given introduction about our platform, so no need to go for that again. So, let me share my screen and go to the session, right? Okay. Okay. Students, can you see my slides? Can you see my screen now?
No, sir.
Yes.
No,
Okay.
sir. No, sir.
No. Okay. Let me.
No.
No,
Okay.
sir.
Is it okay now?
Yes,
Yes,
sir.
yes.
Okay. Okay.
Yes, sir. Yes, sir.
Okay. Now let's get into the topic. Huh? Okay. Good afternoon, dear students and the academic staffs. First of all, thank you, ma'am, for having this opportunity and for arranging this kind of webinar to give the IoT concepts for your students. Students, please excuse me because frequently I get the incoming admission, so I need to minimize the screen and admit all. Please excuse me for that. Okay. So, okay. Okay, as I have explained, myself, Gaston, the founder and the admin of the healthcare engineering platform. In today's webinar, our team is going to talk about the applications of IoT in the healthcare industry. As the first speaker, I'm going to give you an overall idea on the concepts of IoT and its impact in the healthcare sector first. And then I will come out and give you the general definition of IoT. In my later slides, I will go deeper and explain how the IoT interacts with healthcare in different points of view. Okay, let me give you some general introduction about IoT and its application in the healthcare industry. IoT is an advanced application of internet connectivity into all physical devices which can be synchronized and controlled remotely. Nowadays, these concepts are widely used in each and every field and make the human life more sophisticated ever than before by connecting all smart devices and resources we use in our day-to-day life through the internet. Applications of this IoT in healthcare services are a new concept in healthcare sector. Thus, it is more focused and many researches are conducted in this area. Due to overpopulation, economical crisis, increasing amount of chronic disease, lack of knowledge to maintain a balanced and healthy life, inability to get immediate medical access, living below the poverty line, lack of healthcare providers in remote areas are some major facts which urge to focus on advanced technology where this IoT concept is successfully applied. Due to some major advantages of these concepts, such as monitoring and consulting a patient from anywhere around the world, healthcare providers can work from their convenient places, like from their home and offices, saving a lot of time and money of the patient which spent unwantedly during the waiting time at the hospital and paying for hospital utilities as well. In future, most of the patients will prefer to get these kind of monitoring services from their healthcare providers. Now let me give you the general definition of IoT. The concept of IoT means Internet of Things is playing an important role in all over the industries in the modern days. And soon it will become more important application which we cannot live with. According to Oracle's website, the Internet of Things describes the network of physical objects, mentioned as things, that are embedded with sensors, softwares, and other technologies for the purpose of connecting and exchanging data with other devices and systems over the Internet. Now let's think about why using IoT in the healthcare industry. Nowadays, due to the booming growth in healthcare industry, many researches are carried out on these IoT concepts and several techniques are widely absorbed in order to provide the best medical assistance with cutting-edge technology with less effort and to reduce the cost for the healthcare services. At the same time, the healthcare industry had experienced a number of problems that are still far from being solved. Some examples are low patient engagement and medical adherence. Let me talk about that. Often patients simply ignore the requirement of a specialist using folk remedies or a drug that is advised by a friend. Using IoT healthcare solutions that allow remote tracking of medication adherence and patient engagement. The treatment process will always be under the control of a doctor. The second example is slow treatment process and delays in hospital discharges. Even on normal days, hospitals often do not have sufficient staff power to serve all the patients that are coming in. Pandemic only escalated these problems in times and showed the weakness in existing healthcare process. Add to that a lack of qualified specialists, low number of well-equipped rooms, and many more. Integrating Internet of Things to healthcare industry, we can significantly speed up and simplify the process of providing assistance. Connected technology can help monitor patient admission, optimize workflows, predict the influx of patients during an epidemic period. The third reason why IoT is being used in healthcare industry is underfunding and misplacement of resources. Modern medicine is very resource intensive and it is not always possible to meet all the requirements. This is especially true for Asian, African and Latin American countries. IoT will significantly reduce the cost of maintenance of premises, personnel, transport and many more. Now let me talk about the role of IoT in the healthcare industry. Patients with chronic illness such as diabetes, heart disease, arthritis, kidney disease, AIDS, lupus, multiple sclerosis are need to be treated for a long term and monitored frequently for any sudden risks. Poverty, lack of transportation services in remote areas, physical impairments to travel and to reach the hospitals, long queues and waiting lists in hospitals, and lack of healthcare providers are some facts which make the patients of rural areas of developing countries to face certain risk conditions such as sudden heart attacks, strokes, get into coma stage before getting the proper treatment. Even the medical aids are given after facing such worst conditions. There are possibilities to lose lives due to late medical treatments after those worst conditions. The major reason for people of developed countries also face such risks, even though they have all medical facilities, are because of lack of time to take care of their own health due to the workload and stressful life they live in. Let me give you some examples. Reducing extra money and emergency room wait time, tracking patients, staff and inventory, ensuring the availability of critical hardware, enhancing drug management. Therefore, applications of advanced technology into healthcare with the help of IoT concept are widely welcomed by the healthcare providers and the patients with a great hope. And in near future, this will be a very important practice in all over the healthcare industry. Please excuse me for minimizing this one frequently because I always get the admissions. Okay, come back to the main slides. Let me talk about the main applications of IoT in healthcare. I'm sorry, I get another admission. Okay, so IoT in the healthcare can be applied mainly into four areas. First one is for patients. Second one is for physicians. Third one, IoT for hospitals. And the fourth one is IoT for insurance companies. So these are the major applications, right? So let me talk about these individually. Let's talk about IoT for patients. Devices in the form of wearables like fitness bands and other wirelessly connected devices like blood pressure and heart rate monitoring cuffs, glucometer, and many more devices give patients access to personalized attention. These devices can be turned to remind calories count, exercise check, appointments, blood pressure variation, and much more. IoT has changed people's life, especially elderly patients, by enabling constant tracking of health conditions. This has a major impact on people living alone and their families. On any disturbances or changes in the routine activities of a person, alert mechanisms sending signals to family members and concerned healthcare providers. The second major application is for doctors or physicians. By using wearables and other home monitoring equipment embedded with IoT, physicians can keep track of patients' health more effectively. These can track patients' adherence to treatment plans or any need for immediate medical attention. IoT enables healthcare professionals to be more watchful and connect with the patient proactively. Data connected from IoT device can help physicians identify the best treatment process for patients and reach the expected outcomes. The third major application is for hospitals. Apart from monitoring patients' health, there are many other areas where IoT devices are very useful in hospitals. IoT devices tagged with sensors are used for tracking real-time location of medical equipment like wheelchairs, defibrillators, nebulizers, oxygen pumps, and other monitoring equipments. Deployment of medical staff at different locations can also be analyzed real-time. The spread of infections is a major concern for patients in hospitals. IoT-enabled hygiene monitoring devices help in preventing patients from getting infected. IoT devices also help in asset management, like pharmacy inventory control and environmental monitoring, for instance, checking refrigerators, temperature, and humidity and temperature control. The last general application for IoT is in healthcare insurance companies. There are numerous opportunities for health insurers with IoT connected intelligent devices. Insurance companies can leverage data captured through health monitoring devices for their underwriting and claims operations. This data will enable them to detect fraud claims and identify prospects for underwriting. IoT devices bring claims handling and risk assessment processes. In the light of IoT captured data-driven decisions in all operation processes, customers will have adequate visibility into underlying thoughts behind every decision make and process outcomes. Insurers may offer incentives to their customers for using and sharing health data generated by IoT devices. They can reward customers for using IoT devices to keep track of their routine activities and adherence to treatment plans and precautionary healthcare measurements. This will help insurers to reduce claims significantly. IoT devices can also enable insurance companies to validate claims through the data captured by these devices. Now let's talk about the main benefits of IoT in healthcare. So once you take any concepts, it has two sides. One is benefit and the other one is disadvantage, or we can say challenges. So let me talk about the benefits of IoT first. The first benefit is simultaneous reporting and monitoring. So what do you mean by simultaneous reporting and monitoring is all the data we get from the patient or from the environment can be transmitted real time to the receiving part. So we can get all the results simultaneously. So this will make the reporting and monitoring part so easily and very quickly as well. The second benefit is end-to-end connectivity and affordability. Since all the digital devices or smart devices are connected via the cloud, we can get all the data very quickly. So that's what meant by end-to-end connectivity and affordability. So we can get all the medical data very easily with the correct approach. Data assortment and analysis. Since we are using the cloud platform, all the data are being stored and analyzed in the cloud itself. So the data assortment and analysis, everything is done in the cloud. So that's how we receive the analyzed data very easily. Another question. Okay. The other benefit is tracking and alerts. Of course, I have mentioned this one in my previous slide. With the help of sensors, wearable devices, we can track patients or even the medical equipments in the hospital. We can track easily, and whatever happens to the patient or if the medical equipments are misused, we can get the alerts. The other benefit is remote medical assistance. I'm sorry, I get that machine. Remote medical assistance. So since everything is being digitalized and everything can be controlled remotely, so nowadays the patient can reside in a country and the doctor can reside in another country, but the doctor can prescribe and give his medications to the patient via the remote medical assistance services. And obviously IoT gives and plays a vital role in research as well. As I have mentioned earlier, IoT has its own challenges. We cannot say disadvantages, we say challenges. So these challenges can be solved easily in future. First challenge we can face is data security and privacy. Since the data are being stored digitally, the digital data is very vulnerable, as you know. The hackers can steal, and we have a high possibility for losing the digital data. So that's what meant by data security and privacy issues. And the second challenge we can face here is integration between multiple devices and protocols. Let me give you an example. So we have our smartphone, and we have another smart device. For example, let's say we have a smart ECG machine. We are going to connect our smartphone with a smart ECG machine. Since the ECG machine is from another manufacturer and my smartphone is from another manufacturer, the protocols or the softwares sometimes won't be synchronized with each other. So this will affect the data transmission. That's what meant by multiple devices and protocols integrations. And the third challenge is data overload and accuracy. Because we are serving a lot of digital data in our server, the data overload is very high in IoT concepts. This gives some kind of misplaced values or false values in the whenever we ask back some kind of values. So these kind of data overload may give some kind of wrong answers as well. That's what we meant by data overload and accuracy. Obviously, the cost is the last challenge in IoT because it's very costly at the moment. We hope that in future the biomedical engineers and the healthcare engineers will work a lot and invent some ways to make the IoT applications affordable to the general public. Okay, these are my topics and these are the things I would like to share with you guys. So I would like to get some questions from my slides. Students, do you have any questions from my concept? I have explained some kind of a general things about what is IoT and how the IoT is being applied and what are the advantages and challenges. So my second speaker will specifically talk about some kind of a prominent or advanced applications in the healthcare industry. So any questions you guys have from my contents? We would like to get some questions from the students. Any questions? So in that case, can we go to the second speaker? Yes or no? Okay, so I guess that you guys don't have any doubts from my section. So before handing over to my second speaker, Sumita, once again, I would like to remind you about our healthcare engineering YouTube channel. Please pay a visit to our YouTube channel. We have several educative materials for the students. And we have talked a lot about medical devices as well, and apart from that we have several useful information from several healthcare professionals by doing interviews and getting the advices. Please pay a visit, and if you really like our channel, please subscribe and support us. And apart from that, please join in our WhatsApp group and Facebook group as well to stay with us and to keep in touch with us, to know more about us, and for getting our updates as well. Okay, so in that case, if you guys don't have any doubts, let me hand over the session to Sumita. And Sumita, please share the links with the students so that they can easily visit our YouTube channel and be part of our healthcare engineering Facebook group and the WhatsApp groups. Once you share the link, you can take over, Sumita, and you can talk about your concepts.